10 years ago, you spent a week in interventional radiology during school. Now IR job postings are everywhere. But how do you leap from diagnostic imaging to minimally invasive, image-guided therapies? Let's break it down. Ready to learn about vascular interventional radiology? Let's get to it. You've spent years mastering diagnostic imaging, capturing images of disease, but IR, it's medicine in motion. Instead of finding problems, you're fixing them. A patient arrives with a life-threatening blood clot. Instead of open surgery, a radiologist threads a catheter through a tiny needle prick in their skin, guided by fluoroscopy. A few minutes in catheter exchange later, the clot's gone. In diagnostic radiology, you're the detective, uncovering clues. In interventional radiology, you help the interventionalist decipher the clues with image guidance. Using fluoroscopy, ultrasound, CT scan, or MRI, you'll guide wires, catheters, and stents to treat everything from blocked arteries to cancerous tumors. IR differs from traditional invasive surgery, being that the point of access is a small incision, and it all starts with a technique invented in 1953 by a Swedish radiologist named Dr. Seldinger. The Seldinger technique is utilized in many minimally invasive procedures. Step 1, a needle, tiny, hollow, pierces the vessel. Step 2, a flexible guide wire slips through. Step 3, the needle's removed, but the wire stays. Step 4, the catheter slides over the wire, becoming a superhighway for treatments, and of course, Dr. Dotter, the father of interventional radiology, introduced the first transluminal angioplasty in 1964. Vascular interventional technologists have 3 vast categories of responsibility that we will briefly review: patient care, image production, and procedures. Patient care. You're not only positioning arms, but also communicating. You're explaining procedures and radiation risks while calming nerves, patient assessment, and prep. You're screening for contrast allergies, NPO status, and decoding lab results. Patient monitoring and documentation. Physiologic monitoring, including blood pressure, and spotting complications before they spiral. O and ACLS certification? Mandatory. When a patient crashes, you're not just assisting, you're saving lives. Image production. Fluoroscopy, live or real-time imaging, digital acquisition, post-processing for reconstructions, and of course, PACS. Ultrasound, your GPS for navigating veins. Procedural equipment, pressure injectors, IVUs, cryo and microwave ablation, thrombectomy and thrombolysis machines, laser, pressure transducers, the list goes on. The catch? Proficiency is non-negotiable, but it can seem impossible without a certain frequency of studies. Platforms like Imagely AI can assist on an organizational level or an individual in maintaining proficiency without derailing your workflow. Radiation protection, including collimation, frame rates, last image hold. All technologists are familiar with ALARA, as low as reasonably achievable, lead aprons, and radiation reporting. Procedures. Vascular diagnostics, injecting contrast, iodine or gadolinium-based, and even CO2 to map blood vessels. Vascular interventional, angioplasties and deploying stents, yanking clots, thrombectomy, embolizing tumors, venous access to name a few. Non-vascular, draining abscesses, placing feeding tubes, even zapping tumors with microwave ablation. And yes, you'll learn to scrub in, prep the patient, set up sterile fields, pass catheters and wire like a pro, and driving the fluoroscopy table, the reality check. Call shifts, midnight emergencies, weekend dramas. But here's the perk. You get paid to be on standby. Work-life balance. In IR, it's a tightrope. Not for everyone. But if you thrive in a fast-paced, team-driven war zone where every day is a new puzzle, you'll never look back. Find your niche. We know IR isn't one size fits all. Consider interventional oncology, zapping tumors with lasers, or pediatric IR, tiny patients, giant impact, or neuro IR, battling strokes in real time. How to certify. The ARRT's 24-month certification pathway isn't a walk in the park. Logging procedures, structured education, examination. But IR is exploding. New treatments, new ways to save lives. You could be the technologist who helped pioneer the next big thing. So will you stay in the diagnostic lane or step into a field where you help treat the diseases you once imaged? The future of medicine isn't just in scans, it's in action.